I'm going to talk about my discovery project for week 8, so it kind of wraps up the entire semester, 8 weeks of class. Overall, I can say that I've actually learned quite a bit, and it was kind of hard for me to choose kind of which 3 topic or areas that I was going to kind of talk about in my discovery project. I think my biggest thing that still shocks me to this day is the nursing shortage that we continue to have, that we face here in America. And maybe it's nationwide or worldwide that we face. But I know that when I did this article, I think it was week 2, about nursing shortage, that there was this little county up in Illinois, which is about the size kind of our county that I live in right now, and there was 1,059 jobs for registered nurses that they had opening, and I was just shocked by those numbers. And then I went on to read a little bit more, and they were talking about retirement and what we're going to do in 10 to 12 years when the baby boomers end up retiring. And that number that I saw, I think that somebody else posted it during the class, that there was supposed to be over 1 million retirees that are going to happen in the next 10 to 12 years, which is extremely scary when you look at already our hospital settings, how short-staffed we are. Our ratios have increased from nurse to patient ratios over the years. ER patients, we used to always kind of be a 1 to 3 ratio. It's not uncommon for an ER nurse to have a ratio of 1 to 5 just because of staffing, and we feel like we as nurses have to take on those patients, especially in the emergency room, because they're there and they need to be seen. Going back on it, however, I feel like it's unsafe at times what we are doing, but then again, do we leave them in the waiting room or do we put them back in a room? So I think that we're going to have to start with our education system. And this kind of brings up 2 different points. And one of my other discovery was talking about the advanced placement or advanced career, which I'll talk about that in a second. But I think that to get our nurses kind of where we are, we're going to have to increase our colleges that we have in the United States. And I think we're unfortunately going to have to increase our ADN programs and our BSN programs so we can meet that 1 million mark, in 10 to 12 years. The other big thing is I think that I've learned on this is how much less of an income that educators earn compared to hospital nurses. And I think the only way that we're ever going to get that change is we're going to have to increase their pay rate. They're a valued part in this healthcare system, and they need to be making quite a bit more. And I think with that, we would have more people getting into education. And if we had more people in education, we could open up more classes and more schools. So, we at my facility that I worked at, which we talked about this, I think in week 2, is kind of how we do and how we justify hiring and how we try to get nurses to come to our facility. And we do tuition reimbursement, which has been huge and successful for us. So we can bring maybe an ADN nurse in and try to get them right back into a BSN program and pay for their entire program. We allot a little over $10,000 for full-time staff members, which we've increased over the last couple of years to try to be a little more positive and closer to some of the other facilities to try to reach out and try to get them to our hospital. So it's kind of interesting to kind of read in the discussion points about what other facilities around the United States are kind of doing to draw people into their facilities. And we also now have implemented, I think I read something else in discussion point, that people are hiring, way before they graduate, and we're hiring sometimes 6 months, 8 months before they even graduate nursing school. We'll go ahead and sign a contract on them just so we can fill our hard to staff positions, which 4 or 5 years ago I don't think that anybody would have ever been doing that. The other thing that I kind of wanted to talk about was the ongoing issue of entry into practice in our field. And I agree on some points that a BSN is a better license to hold. Obviously, it comes with more education. You do have more of the theory-based background, a little more of the evidence-based practice learning, a little more of the research side of things. But I don't see anything wrong with ADN nurses, and I think the ADN nurses have their place. Maybe it's not necessarily in the hospital setting, because there has been studies like we have read in, I think it was week 2 or week 3, about the mortality rate, that there's a less of a mortality rate when it comes to BSN nurses. So, and I can see as a management that there is a difference between some BSN versus ADN nurses, but I think a lot of it also becomes experience, because I know a lot of great ADN nurses that have no desire to go back and get their BSN. However, if we want our nursing profession to grow as a whole and be respected like some of the other positions in the hospital are, we are going to have to convince everybody to become a BSN or higher. I mean, when you look back at some of the other roles in the departments, dietitians, social workers, they all are required to have a BSN. Nowadays, physical therapists, occupational therapists, speech therapists, they're all required to have a master's or even a doctorate. So I think if we want to try to get on the same page and increase our respect for the professionalism, we're going to have to, as a whole, increase our education. I think that we'll have to require a BSN. And I know that some of the stats that I pulled in 2010, 55% of the nurses had a BSN or higher nationwide. So I mean, that still leaves 45% that aren't, and the goal obviously is by 2020 is to have 80%. So we have a long ways to go, but I think that overall we're going to have to push that to be on the same playing field as everybody else and get the respect that we deserve. The other big thing that I really liked in this class, when I forgot what week it was the whole evidence-based practice and research. And this has kind of always been a struggle for me, and I think it was just because of the route that I took, that I did a lot of pre-hospital medicine before I got into nursing, though. But my paper that I wrote, I could kind of now distinguish the difference really between research and evidence-based practice. In research goes a lot with the qualitative and the quantitative studies that assist in the research process. And research is a systematic and scientific review of a particular question that you're trying to kind of find the answer to, or you're going to test your hypothesis using controls and other methods throughout. As unlike evidence-based practice, does not really develop new knowledge, but you're using data that we've had for a lot of times years and years that we know that works. We've found this evidence in the past, either from studies, from patients' experiences, from hospital experiences, from clinical judgment, and we know that it works, and we know that it's best evidence in the clinical practice. And a lot of it is just knowledge base and knowing what works and what doesn't work. So I think that that piece of the papers that I did, I think were still probably one of my favorite, was evidence-based practice, which I'm still now finally kind of grasping truly what evidence-based practice is. But I am a firm believer of it. If it works, why change it? And coming from the emergency room, we implement a lot of these evidence-based practice on certain diagnoses that we admit, which is more of a Joint Commission Medicaid Medicare standard. But pneumonia is a big one. We now have set evidence-based practice that we know that works in pneumonia, and it's little things of like IV fluid, lactic acid, blood cultures, antibiotics start in a certain amount of time. So I think that those that they work, and it looks like obviously our patient outcomes are better. So overall we are treating the patient better, and we get better outcomes for the patient and for the hospital. So I am a firm believer of evidence-based practice, and I hopefully in the next 2 or 3 classes that I take that we kind of dive in a little bit more on evidence-based practice, but I do like it though. The class has been good. Like I said, I've learned a lot. This is my first master's class. It went by really quick. I wasn't expecting it to go by so quick. I think though I truly got more out of the discussion points than anything in this class, and I really like what other, it was kind of fun reading, what other systems and hospitals do in a lot of these questions. And obviously not everybody's from kind of the Midwest, but you can see that we've had people kind of all over the United States. So it was nice to kind of get their view on different things and takes on how they do things versus how we do things up in this area. So discussion points by far were my favorite, and hopefully we continue those in my next couple classes that I'm on.